بسم الله الرحمن الرحيم. هنتكلم مع بعض النهاردة عن القدم السكري. هنتكلم مع بعض عن diabetic foot. What is the meaning of the diabetic foot? Diabetic foot, any pathological changes that occur to the foot of diabetic patient. طيب عايزين نعرف ايه اللي بيؤدي الى diabetic foot. What is the pathogenesis of the diabetic foot? The pathogenesis of diabetic foot is a multifactorial. Neuropathy, vasculopathy, and immune dysfunction. Neuropathy, vasculopathy, and immune dysfunction. Prolonged hyperglycemia contributes to all the following above factors. Neuropathy may be motor neuropathy or autonomic neuropathy. Inflammations of the motor nerves leading to weakness and wasting of the intrinsic foot muscles. This leads to foot deformities, abnormal gaits, and lastly ulceration of the foot. يبقى عندي أول حاجة في neuropathy inflammations of the motor nerves that leads to weakness and wasting of the intrinsic foot muscles that lead to foot deformity, abnormal gait, and ulcerations of the foot. Ulceration means loss of the normal covering tissue. And the inflammations of the nerve fibers may be autonomic neuropathy, inflammations of the autonomic nerve supply. Inflammation of the autonomic nerve supply leading to decrease of sweating of the foot. Decreased sweating leads to drying and brittle skin. Dry and brittle skin causing fissures and cracks. Fissures of the foot complicated by secondary bacterial infection. The strongest organism that infects the foot is the Clostridium group. That leads to finally the gangrene. That leads finally to the gangrene of the foot. The second cause of the diabetic foot is vasculopathy. Inflammations and pathology of the feeding vessels. In diabetes, there is macro and microangiopathy. Macroangiopathy means atherosclerosis of the large arteries. Microangiopathy increased thickness of the basement membrane and endothelial proliferations that leads finally to the capillary damage. Decreased local blood flow to the foot هيؤدي معايا إلى poor antibiotic penetrations and poor wound healing. Poor antibiotic penetrations and poor wound healing. Microangiopathy أشهر حاجة بتحصل في المايكروانجيوباثي عندي الريتينوباثي والنفروباثي والنيوروباثي. The third cause of the diabetic foot is the immune dysfunction, impaired defense against infections. As we know, fissure of the foot leading to secondary bacterial infections. هذه العدوى by microorganism impaired defense against this microorganism because there is decreased field polymorphonuclear leukocytes migration to the site of infections, leading to decreased phagocytosis, decreased intracellular killing of the organism, decreased chemotaxis of the organism to the site of the bacterial infections, decreased chemotaxis of the inflammatory cells or of the immune cells to the site of the bacterial infections. طيب, what is the classifications and staging of the diabetic foot? Wagner's classifications of diabetic ulcer. It is the most widely quoted classifications. It grades the foot depending on severity. Grade 0, intact skin, impending ulcers. Grade 1, superficial ulcerations of the foot. Grade 2, deep to tendon, bone, or ligaments. The ulcer penetrates the soft tissue of the foot. The third grade is the inflammations of the bone of the foot, osteomyelitis. The fourth grade is gangrene of the toe or the forefoot, the proximal part of the foot. The fifth grade is gangrene of the entire foot. The fifth grade is gangrene of the entire foot. هذه الصورة توضح ال classifications of the diabetic foot. Ulcerations. The first grade is intact skin. The second one is ulcerations of the superficial part. The third is ulcerations penetrate to the soft tissue of the foot and osteomyelitis. The fourth grade is localized gangrene. The fifth one is gangrene of the entire foot. بإذن الله في فيديو تاني هنوضح مع بعض prophylaxis and prevention of the diabetic foot and methods of treatment of diabetic foot. السلام عليكم ورحمة الله وبركاته.